Hi everyone, my name is Matthew Dutton, Skincare Coordinator for the South Eastern Sydney Local Health District, and a big thank you to Gary for inviting me to speak on this vlog. Prior to my role as the Skincare Coordinator, I was the Wound Care Clinical Nurse Consultant for the St George Hospital here in Sydney, Australia for a total of 15 years. My current role encompasses leadership and strategy for the local health district, but also encompasses a small clinical role for areas and sites that don't have a wound care expert to support them. My key advice for a new clinician would be wrapped up in one word: why? We really need to understand the whys of a wound and the patient. The old adage, treat the whole patient, not the hole in the patient. We need to do an accurate wound assessment. We need to perform appropriate diagnostics. We need to know what we're dealing with, not just give it our best guess based on a vague range of assumptions. Just because an ankle brachial index in a patient is normal, it doesn't equate to the patient having a venous leg ulcer. It just means that that patient doesn't have arterial disease and that isn't influencing the wound. A lot of assumptions are made in wound management. We need to use good assessments, good diagnostics, and find out what is wrong with our patient and give an accurate diagnosis. So really, we need to know why, what's going on. To be honest, there are a lot of experiences over my wound care career that have been satisfying and rewarding. It's what makes the job so good. It's really hard to narrow it down. And while I'm one, not to be shy about telling you how fantastic I am at what I do, I'm not one to seek out the Mutual Appreciation Society and give myself a great pat on the back and expect other people to pat me on the back either. So what I actually find very satisfying is when you meet a patient and after you've spoken with them and discussed with them, the look on their face that they get when they realize they are talking to someone who knows what they are talking about, and they are talking to someone who they believe can help them. Now, the help we give may not always be the help they necessarily want, especially if we're being realistic about their care. But that look they give you is worth $1 million. It's the faith they have in you as a clinician. And we need to work hard to engender that faith. The worst bit of wound care advice I've ever been given. I've been given a lot of bad wound care advice over the years. Dry it up, get the dog to lick it, put Vegemite on it, go stand in the ocean for a couple of hours and get the patient to do that every day. You could do that down the road from St George Hospital. We've got Botany Bay down there, which has got some fantastic industrial sites on its perimeters. So yeah, there's lots of bad advice out there. There's also some misguided advice that comes out there, some ill-informed advice. So I think education is the key. Thank you very much.